entirely only corpus callosum, but the inferior one is also limited by the caudate nucleus.
And the calcareous collateral trigone.
It's in the specimen. Yes? Do you want to find it? Let's go to find it. Who is it? Who is on duty? Prepare specimens. Use gloves. Yes, take everything. We need everything. And where is your stick to demonstrate?
वो basket
बास्केट में बस मैं ही नहीं रखती
You have to go to hospital. You have to go to doctor.
उंगली की
Once you can go, then you will take statement, справка, and you will answer different classes. So you asked about calcar avis and everything that is in the posterior and inferior horn, yes? So the calcar avis will be located here. This one is calcar avis. You see, it's protrusion formed by the calcarine sulcus. And the eminence will be located between them, between the posterior and inferior horn. It's collateral eminence. It's formed by the collateral sulcus. So when you form this sulcus on the surfaces, you'll see that the collateral sulcus will be here, this one, it's protrusion from this sulcus, and the calcarine one will be here on the medial side. It's protruded in the posterior horn. Any more questions?
Yes, ma'am.
Yes.
Flow of venous sinus and cerebrospinal fluid.
Venous sinuses?
Yes, ma'am.
Take the moulage, model. Moulage, model. So which one sinus was not understanding?
Flow of venous sinus and cerebral. Flow of sinus.
Actually, the previous teacher, we could not communicate properly. We could not understand the language. What she was trying
No,
to
you just need to show all the sinuses.
show.
Do you mean sinuses? What do you
Flow
mean?
of the sinus.
So outflow, drainage. You mean. So when you talk about sinuses, you talk about the superior sagittal sinus, which along the sulcus with the same name. Then inferior sagittal sinus. It's inferior sagittal sinus along the inferior border of the cerebral pharynx. Then we have the straight sinus. Then this one is occipital sinus along the internal occipital crest. Transverse sinus, again in the same sulcus, continues into sigmoid sinus, and then along the borders of the temporal bone there is a superior and inferior petrosal sinuses. Aside the sphenoid bone, the cavernous sinus and intercavernous sinus, and along the lesser wing there is a sphenoparietal sinus. What is more, we should say that all these sinuses are drained together to flow the venous blood to confluence of sinus, And then from this part, there are three different directions for venous outflow. The first of them is the jugular vein. It passes jugular foramen. The second is the basilar plexus to go to the vertebral plexuses, and the third one is directed to the superficial veins of head. They are on the surface of head and superficial veins of face, and the anastomosis between the sinuses and the superficial veins are formed by the diploic veins and emissarial veins. Emissarial veins, examples, it's given in your textbook, such as the condylar foramen, the mastoid foramen, and also the parietal foramen. They are for emissary veins to drain venous blood, as the anastomosis between the sinuses and superficial veins. Do you mean this one? Yes?
Yes, ma'am.
What else?
What was the question?
And the receptors, three types of receptors.
वो तो था ही, रुक जाओ.
Receptors with doing tracts. Yes,
Yes,
tracts. So when you are talking about tracts, conduction tracts, the ascending tracts are divided into groups accordingly with the receptors where the impulses were originated. Example are the receptors on the surface of skin. Yes, they are external receptors, extra receptors. And the tracts that start from these receptors. Здравствуйте, доброе утро. Спасибо. So this one is the extra receptors, which take impulses from skin, and the senses of touch, pain, temperature are delivered through the tract called the spinothalamic tracts. Then the proprioceptors, which are in the tendons of muscles, capsules of joints, they are directed to cortex. In this case, they are proprioceptive pathways with cortical direction, ganglio-bulbo-thalamo-cortical tract. And they could go to cerebellum. In this case, they are spinocerebellar tracts. So they are proprioceptive, but with the direction to cerebellum. And there are also internal receptors inside the internal organs, interoreceptors.
Ma'am, what is the difference between anterior spinal cerebral tract and posterior spinal cerebral tract?
The differences is in topography. The both are involuntary, no. In topography, so if it's posterior spinocerebellar tract, you see, it's directed to the same site where it was originated, and it passes through the inferior cerebellar peduncles. The anterior spinocerebellar tract, it crosses the midline, goes to the opposite side at the level of the segment of spinal cord, goes upwards through the superior cerebellar peduncles. They are different by their topography, location.
Spinal thalamic tract. Explain.
Spinal thalamic, all the tracts are given in these guidelines. You should learn it by heart. So if
Ma'am,
you
where is the first neuron, second neuron, third neuron, and fourth?
yes, if you don't want to know a lot, advanced information could be cancelled, yes, but the most important, that is above it. So advanced, no, it's not for everybody. If you want to get 9 or 10, for example, advanced information, but if you don't need it, just this information. So when you are talking about the which one you ask?
Spinal thalamic tract.
Spinothalamic tract, yes. So the first neuron is the extra receptors dendrite to go to the ganglion, spinal ganglion. It's the first neuron. The axons of this ganglion directed through the posterior lateral sulcus to go to spinal cord. And here you see there are different options. One of the tracts can go to the lateral column, and it will be the lateral spinothalamic tract. The second will be in the same place where it was originated, anterior spinothalamic tract. They pass medulla oblongata, pons, midbrain, and terminated in thalamus. The anterior spinothalamic tract is responsible for touch, the lateral for pain and temperature. But you see there are also thalamocortical fibers, yes, to recognize what type of impulses had happened. So it's already the impulses to get to the cortex of brain. But the spinothalamic tract is involuntary tract, sensory involuntary tract, to be terminated in thalamus. Tract is very well described here. You can learn it by heart.
पिछले क्लास में सबको समझ आ गया
घंटा को सुना
बोलो
आता ही नहीं क्या लंडा
अरे इससे बोलो ना मैं फिर से पढ़ा दूं नहीं आया समझ
the last topics are
नॉट क्लियर